Hello, my name is Anna Gerard, and the grand challenge I have chosen to speak about is building healthy relationships to end violence. So my focus for this grand challenge is intimate partner violence and what we as social workers can do to prevent it. So to begin, I want to share exactly what I'm talking about. According to the CDC, intimate partner violence is defined as abuse or aggression that occurs in a romantic relationship. And an intimate partner can refer to both current and former spouses and dating partners. Intimate partner violence can vary in frequency and severity, and it comes in many different forms. So it can include physical violence, sexual violence, stalking, and psychological aggression. Intimate partner violence also does not discriminate based on socioeconomic status, gender, or race. So why is this relevant? Well, approximately 36% of Michigan women and 26% of Michigan men experience intimate partner violence, intimate partner rape, or intimate partner stalking in their lives. In the year 2019, there were 44 reported domestic violence murders in the state of Michigan. Also in 2019, there were 57,018 incidents of domestic violence that were reported to Michigan police. As we know with many things, those were just the reported numbers. So many do go unreported. Here's a headline from a local news station in Detroit. As you can see, the headline reads, "Experts warn of increase in domestic violence as cold weather approaches." According to the American Journal of Emergency Medicine, domestic violence cases increased by 25 to 33% globally in 2020. The COVID-19 pandemic has increased social isolation and made it even more difficult for those trying to escape intimate partner violence. So why did I choose the grand challenge of building healthy relationships to end violence? And more specifically, why did I choose to focus on intimate partner violence? Well, intimate partner violence is a significant public health issue in the United States, and it impacts us both at an individual and societal level. According to the National Coalition Against Domestic Violence, on average, nearly 20 people per minute are physically abused by an intimate partner within the United States. This statistic equates to more than 10 million women and children being physically abused by an intimate partner. 1 in 3 women and 1 in 4 men have experienced some sort of physical violence by an intimate partner. That could include slapping or shoving or pushing. 1 in 7 women and 1 in 25 men have been injured seriously by an intimate partner. 1 in 10 women have reported being raped by an intimate partner. Unfortunately, there is no data to know how many male victims have been raped by an intimate partner. 1 in 4 women and 1 in 7 men have been victims of severe physical violence at the hands of an intimate partner in their lifetime. When I say severe physical violence, that could mean things like beating or burning or strangulation. 1 in 7 women and 1 in 18 men have been stalked by an intimate partner to the point in which they felt fearful or believed that they or someone close to them could be harmed or killed. Nationally, intimate partner violence accounts for 15% of all violent crime. And on average, there are over 20,000 phone calls placed to domestic violence hotlines nationally daily. Women between the ages of 18 and 24 are the most commonly abused by an intimate partner, and 1 in 15 children are exposed to intimate partner violence each year. 90% of these children are eyewitness to the violence. It's been researched that being a victim or a witness to intimate partner violence is correlated with a higher rate of suicidal behavior or depression, and it can affect physical, mental, sexual, and reproductive health. Increased anxiety, PTSD, depression, and increased suicidal behavior has also been found. According to the CDC, there is no one direct factor that can 100% predict the likelihood of intimate partner violence perpetration. However, there are specific risk factors that may increase the likelihood. Some of the risk factors that may increase the likelihood of intimate partner violence perpetration are heavy alcohol or drug use, anger or hostility, economic stress, witnessing familial violence as a child, low education or low income, and a history of being physically abused. I believe that intimate partner violence is preventable. Earlier prevention efforts, such as education on forming healthy relationships, creating protective and safe environments, or promoting healthy, nonviolent communities and relationships, can reduce the number of intimate partner violence that we're currently seeing. There are many different agencies in Michigan that are doing this work. Agencies such as Turning Point, Haven, La Casa, and First Step are aimed at serving survivors of intimate partner violence and sexual assault in our communities. There have even been efforts to spread awareness of intimate partner violence and encourage prevention that have been made by local police departments, such as Southfield Police Department. I show some photos above of the annual Walk to End Domestic Violence that the Southfield Police Department, in partnership with Haven, hosts, as well as a proposed ordinance to take guns out of the hands of abusers.